Welcome back. Today's medical panel has been answering your medical questions and providing you with a second opinion for your health concerns. Let's get back to those questions. We have Marion from our studio audience. Hi, Marion.
Hi, Libby. I have a question. How can I maintain a healthy heart and reduce my risk of heart disease? For example, I could run up 2 or 3 flights on the subway, but I found in the last year that when I reach the top of the first flight, I'm feeling a little bit huffy-puffy.
Amazing question. In terms of assessing your overall cardiac risk, we look at multiple factors. How active you are, your exercise level, your exercise tolerance, your blood work, diabetes risk, high blood pressure, your current heart health history, your family heart history, if there were previous heart attacks and strokes, among a whole bunch of other things. In terms of, putting a big assessment, we take all of these factors into consideration. Also, let's remember smoking. We can't forget about that one. And good supportive footwear. Those are huge ones. But overall, many things that you can do day to day help reduce that risk. One big thing is, of course, having routine follow-up with your family physician or your primary care provider for routine blood work, for routine evaluation, assessment of your lungs, your heart, making sure that there's no underlying asthma or infection. Those are all very important things. And one big thing would be if you've been doing all of this stuff and you're still feeling like short of breath at the top of those steps, if that is a change from your baseline, that is important to see your doctor about. That's the big one. Because if you find something that you do all of the time to now be more difficult, something may be going on.
I have to say that 1 flight of stairs running up subway sounds good to me. Can COVID affect any of this?
Oh, absolutely. One thing about COVID that we know is that there are a lot of, well, first of all, like we almost have all had COVID, sometimes multiple COVID infections. We've heard rumblings of long COVID. And the tricky part, of course, is COVID affects our respiratory system. What we've seen, just even from a family medicine and emergency medicine perspective, is the rate of infections in the last year, as kids have started to go back to school, like conjunctivitis, ear infections, throat infections, bronchial asthma, COPD exacerbations, you name it, like there have been an increase overall from everyone from kids to our elderly population. I think that COVID is going to have a lot more implications down the line as things continue to come out.
Thank you, Marion.
Thank you very much. Thank you.
Our next question comes via email from Josh. He writes, supplements versus prescription medication, which should I use for my joint pain? Or is there another way I can self-manage the pain through lifestyle changes?
Lifestyle changes are very important in management of pain or any other chronic condition. In every moment, we are in a fight between our baseline of health and everything that wants to make us sick. So we, as physicians, we have been historically focused on what we call pathogenesis, but means what creates disease, but we need to work on salutogenesis, means to creating health. If we elevate our baseline of health, we would be in a much better position to fight any diseases. Using supplement is a part of keeping a good baseline of health. But it's important to know what we lack and take those. And for that, we need to have a good blood work done and evaluate our baseline of health, and based on that, try to supplement what we need. But there are some supplements that are basic and unnecessary. They are necessary for everybody. Probably the omega-3 group that are, good fats that would help our joints, and elements that would, like vitamins that people take, many of them are not necessary.
Okay. Joy sent us an email that says, what are your thoughts on inflammation of the small bowels, for example, Crohn's disease, and recommendations on how to treat it? Is prednisone a good treatment for it? and how long should it be taken? Prednisone is a steroid and has all kinds of side effects.
Well, yeah, no, absolutely. So prednisone can be, most people are very scared of the term steroids because we hear a lot of negative things on the internet about it. However, it used in appropriate situations is incredibly effective. And with inflammatory bowel conditions such as Crohn's disease and ulcerative colitis, you would really want to make sure you are following up with your care team, ideally your primary care provider. Most likely you would be seeing also a gastroenterologist for your routine colonoscopies. But yeah, there are also additional medications to prednisone that you can use in longer flares. Prednisone can be very effective in these acute instances. It can help tone things down really quickly and kindly until you're able to really be stabilized to allow a more chronic medication to be introduced.
Dr. Rod, do you have anything on this?
Probably from the angle of trying to maintain a healthy gut. That's very important. Again, it comes back to keeping a good health baseline. Probably all the food that can induce inflammation, if they can be avoided, they can be helpful in reduction of the ultimate inflammation.
Well, I think the one thing with steroids is if you take steroids for certain things, let's say you've got poison ivy, magic in a few days. If you stay on, and it'll improve your appetite, people have greater energy. The problem is if you stay on it for longer than a couple of weeks, the harms outweigh any benefits because you then start to develop muscle weakness, skin changes, risk of bleeding, change in facies. So you've got to be very careful with these drugs, and it's certainly not something that people should ever self-medicate with. Whenever we use steroids in any of the serious medical illnesses, we always try to use as little as possible to avoid all these longer-term side effects.
All right. When we come back, final thoughts from our panelists. That's next.